Hi, Frank Spanos with Empire Surgical, and today I'm going to talk to you about the anatomy of the knee. Your knee is made up of 4 joints. You have your patellofemoral, your lateral tibiofemoral, your medial tibiofemoral, and your tibiofibular. Now the 4 bones that make up those joints are your femur, which is the largest bone, also known as your thigh bone. Inferior to that, you have your tibia, which is your shin bone. Lateral to the tibia, you have your fibula. It's also important to know that it's always on the outside, which helps you determine which leg you're working with. And lastly, you have your patella, which is your kneecap. This protects your knee and is also connected by your quadriceps tendon to your patellar tendon. Now, what keeps stability in the knee? The ligaments. I'm going to talk to you about 4 ligaments. You have your ACL, your PCL, your MCL, and your LCL. Your ACL and your PCL go hand in hand because they cross. Your ACL is your anterior cruciate ligament, which is anterior to the PCL. And I like to use a little trick with my thumbs, saying that the ACL connects posterior lateral on the femur to anterior medial on the tibia. Then you have your PCL. Your PCL is posterior to the ACL. Now I'm going to flip my thumbs around, and your PCL connects anterior medial on the femur to posterior lateral on the tibia. Next we have our MCL and our LCL. Our MCL is our medial collateral ligament connecting our femur to our tibia medially. And we have our LCL, which is our lateral collateral ligament. This connects our femur to our fibular head laterally. Moving on to our muscles and tendons. I'm going to talk about 3 things: your quadriceps, your hamstrings, and your calves. Now your quadriceps have 4 tendons in them. That's your vastus lateralis, which is on the outside. You have your vastus intermedius, and you have your vastus medialis. On top of all these tendons sits your rectus femoris, which is in the middle, superior to them. Next, we have your hamstrings tendons running medially to laterally. Medially to laterally, you have your sartorius, you have your gracilis, you have your semimembranosus, your semitendinosus, and lastly, you have your biceps femoris. It's important to note with the hamstring that the gracilis and the semitendinosus can be used for an autograft for the patient. And lastly, there's your calves. Moving on to cartilage. I'm going to talk about 2 cartilage. You have your articular cartilage and your meniscus. Your articular cartilage is basically your synovial fluid that provides a smooth surface for your knee so that you can move freely. And then you have your meniscus. You have your lateral meniscus, which is O-shaped, and you have your medial meniscus, which is C-shaped. It provides as a shock absorber. It helps with your hyperextension, and it also keeps the joint space even. Now, most importantly with the meniscus, it's broken down into 3 parts. You have your white-white, you have your white-red, and you have your red-red. Your white-white is located on the inner third of your meniscus, and this is important to note that this is the most avascular, meaning that there's no blood in this area. Now, what's that mean? When there's no blood in that area, it means the chances of healing it are very slim to none. Next, you have your white red. Now, white red meaning there's some blood in there, so that there's some chance that it may heal if there's a tear. And lastly, you have your red. Now, this is located on the outside, most lateral, on the outer third of your meniscus, and this is the most blood in this area. So that if there is a tear in the meniscus, chances are that it can be repaired due to the blood in that area. This has been the anatomy of the knee. Thank you very much.